Every single day, over 1 million ASHA and Anganwadi workers walk into India's villages, carrying little more than a simple register, a weighing scale, and their own knowledge. These women are frontline heroes in communities with little or no medical infrastructure. For decades, families have turned to them with the high-stakes questions that keep parents up at night: difficult pregnancies, infants that won't feed, or fevers that won't break. But no single worker can have the answer to every question. In today's episode, we're talking about healthcare, specifically Wadhwani AI's extraordinary app, HealthVaani. Born out of a partnership between the Ministry of Health and Family Welfare and the Ministry of Women and Child Development, powered by Google AI, this is a multimodal AI tool built for frontline health workers in their own language, in their own dialects. My guests today are Shekar Sivasubramania. He's the head of Wadhwani AI, the organization behind HealthVaani's development. Also with me, Preeti Lobana, Vice President and Country Manager at Google India. She's helped bring the power of Gemini to this challenge. Let's begin this story from where everything begins in India, not in Delhi, but in a village. Shekar, let's really look at the human behind this whole HealthVaani app. Who is the person, the ASHA worker, that really connects and is at the heart of this initiative?
ASHA workers form the backbone of health systems delivery in India. The entire ASHA worker program, supported also by the Anganwadi workers, the two large cadre of individuals are the people who actually touch almost all aspects of rural and semi-rural aspects of healthcare delivery pan-India. So their job is from visiting homes in villages and providing services across the entire gamut of healthcare. And they form the first point of contact whenever there is a family who experiences a health problem. And of course, given the nature of the work that they do tends to be slanted a little bit in favor of women and children, early nutrition, and onward to a multitude of challenges faced. The most important aspect to understand about the ASHA worker is they are integrated into society. They know families. They probably have a tenured understanding of health problems in their region. They are storehouses of knowledge and competencies, and actually kindness and niceness. If you ever visit and speak to ASHA workers, you understand their level of dedication that they have in order to make sure that the healthcare is delivered appropriately, contextually, and correctly to the families that they serve.
Mm-hmm. So it's really about the person, not just the program, but the people behind the program. Tell me about what happened before HealthVaani existed. For instance, when an ASHA worker was asked a question by a mother she didn't have the answer to, because in a sense, I think we need to know the gap before we begin building the bridge.
That's right. And all systems before the existence of technology that was made available, whether it's AI or otherwise, were principally reliant on human communication. Mm-hmm. And society has lived for several years and it's been quite successful. So we must give it a lot of credence and importance.
Yes.
So there are instances where the more senior members who have plied their trade or who have worked in the system long enough understand all aspects and will communicate that, and individuals are expected to learn. The government, of course, formalized this using a series of pen and paper tests, other forms of dissemination. Of course, with the advent of technology, you can digitize all of this. So it's really a game of efficiency at one level. Mm-hmm. The other hidden aspect is trust and reliability. What technology can do is it remembers far better than what human beings are capable of doing. Over a period of time, when an ASHA worker pulls out an app and answers a question to a patient, and the patient says, what's the basis? They're able to say, look, I have a formal, systematic, and a thorough way in which I'm providing you information. That adds that delta of credibility, which is extremely important. It's also a responsibility for organizations like us to maintain that responsibility. That's where we link up to the accuracy, the specificity, the correctness of information that is provided by the service provider, the ASHA person, to the individual. So we connect up at that level. So what was earlier a set of pen and paper tests, a set of older people that they would often get into who were in the ecosystem, now becomes much easier. So the latency, the time that it takes, now when you're a person who's facing a new situation for the first time in a village setting, and you need to now call somebody or physically go meet somebody, there is a certain heart palpitation that comes in.
Yes.
Dar lag jata hai. That is gone. You have this with you immediately. It provides you the first level of support to be able to provide an answer to the person. It allows the ecosystem to calm down.
Yes.
And therefore, it's a huge systemic shift that is not visible today that you will see happen. It will strengthen the quality, confidence, and assurance of health in India.
And that's so interesting. But Preeti, Google has and continues to tackle some of the most technically complex challenges. I mean, whether it's climate change, cancer detection, quantum computing. What was it about what Wadhwani AI is doing here that made Google think that this is where our technology can really help?
So we've been partnering with Wadhwani AI over multiple projects and initiatives over the past few years. And what has been very energizing for us, as Shekar was just articulating, is their approach to working with communities at the grassroots level to drive transformation. And that very closely aligns with our thinking of, that any progress in technology must benefit everyone in society. It's not just about raising the ceiling for a few, it's about lifting the floor for all. And when you look at the power of AI, when developed and deployed responsibly, it has a force multiplier impact in terms of transforming lives across multiple sectors. So when we worked with Wadhwani AI through grants as well as pro bono support to develop an app called Cotton Ace a few years ago that works in 9 languages. And, it gave responses to farmers, enabling them to develop more crop resilience and pest management. And we saw that the manner in which it was deployed, that makes a very critical difference. The
Absolutely,
execution
yes.
of the technology had a real positive material impact on their livelihoods, as well as their contribution to what I call environmental, sustainability. So when we heard that Wadhwani AI is looking to bring that force multiplier effect into the field of healthcare, we were like, hey, this is the right partner to work with. And so we have given a $2.5 million grant through google.org, and which will help pilot HealthVaani. But the real clincher was when we heard that the solution to serve the local communities via ASHA workers needed to be multimodal, not just text, but voice, images, and multilingual, respecting India's, linguistic and cultural diversity. We felt right, deployment for Google AI.
That's really a wonderful collaboration, and it brings me in a sense to my next question, Shekar, because we're talking about over 1 million plus workers across geographically diverse terrain, culturally diverse, different languages and dialects. What are the systemic challenges when, for instance, a mother goes to ask? They're the first point of call for mothers where there's often no medical infrastructure, no alternative to them. What are the systemic challenges that these women are addressing? And also when ASHA workers are interacting with HealthVaani, how Preeti just mentioned the multimodal aspect. Is it through voice? Is it through text, through image? What have you seen so far?
I'll do one anecdote and then, so there's this, we work across 17 states. First of all, I must say, thanks to Google, we are able to try to realize some of the dreams that we have in terms of making India a healthier community. So when you go, and we work across 16 to 17 states. So if you understand the principles of AI, it is about as quickly as possible reaching as large an audience as possible so that you get the maximum amount of experiential data so that your models become better. Now, when you step back from it and go systemically, you start inheriting, to your point, millions, multilingual, multicultural. That's where, as we start deploying, the AI systems will learn all of these aspects. So the only success is not a monolithic single solution. It is a culturally diverse, multilingual, contextually rich, across India solution. We know how to get there. It takes some time, maybe a couple of years. But that's the problem that we are trying to solve for. And we will solve for it because we will, today it's in 4 languages, Marathi, Odia, Hindi and English. Shortly it will become 12 languages. Anything we do, we think of 12 to 15 languages. You cannot even think of it otherwise. And then as the technology matures, as the solutions mature, as the reach becomes better, as the conversations get grabbed, then we have data to be able to analyze where we are going right, where we're going wrong. And the system slowly and steadily improves.
HealthVaani is described as multimodal and powered by Gemini models. In plain terms, what does that actually mean? What is the heavy lifting that the Gemini is doing here?
So we're bringing 2 of our models or technologies, and the combined power of those 2 means that the ASHA workers at the front line will get validated health information at their fingertips to provide support to the local communities, as Shekar was giving us, sharing with us in his example. So the first one is the Gemini Flash models. And these models are built for what I call super high effectiveness. So they combine speed, cost efficiency, and intelligence. And that is what is at the back end when the answers are being surfaced, the retrieval of the information is happening, moderation is happening, and the translation elements of HealthVaani. And this is very, very critical because our ASHA workers work in environments which we call low resource, i.e. the internet connectivity may not be the best. The phones that they have for their apps may not be the highest end phones. So we have to make sure that the model and the capability it brings is able to function really well in those low resource environments to be able to give the best response in the language of choice in the unique cultural context. The second bit is the Gemini embedding model, which helps provide semantic retrieval. What that means is that it understands the intent behind what is being asked and not just matching exact keywords. And what it means for the ASHA worker is that she does not have to frame her question in medical language or in a technical way. She can just in a very conversational tone ask something like, hey, I have seen in a language of her choice that I have seen some marks appear post a vaccination, or even simple thing like what are the dangerous symptoms of a pregnancy, not in a pregnancy. It's not perfect, but she will get the response back, which is because this language, the model helps understand the intent behind the question. And this is, get the right response, which is valid from a health point of view to the ASHA worker in a language of her choice.
I mean, that's such an important point because really, Shekar, getting clinical accuracy right in a local dialect is very, very hard because you're not just translating medical information, you also have to look at it in a context that's culturally correct, it's contextually appropriate, and also medically sound. How did you ensure that what HealthVaani tells ASHA workers is accurate, not just linguistically, but medically?
So you start with the design of the solution. And in the design, the way these technologies work is they have to go to a precise, authorized and confined set of documents or information. The document can contain text, it can contain images, tables, a variety of expressions that the medical community provides as the basis. And so here's the simple AI problem. I give you 1900, 2000, 2500 pages. I give you a question. Get me the right answer from those pages. So the design ensures that the answer has to come from within the contextually relevant document. You're not going to go anywhere here and there. The measurement is to make sure that you got the right answer. And as you build in human feedback loops through testing and through other techniques, over a period of time, very quickly, those answers become very precise, very correct, and medically very relevant. So the design as well as the human support ensures that you always will be responsible in your ability to be able to support the ASHA worker.
Right. Preeti, what's also fascinating is that how does Google build a model which understands a dialect that may have no standardized written form, no corpus, no bank of academic literature? How does that happen?
So when you're solving for problems like that, we think about taking an ecosystem approach, because for Google, any solution has to work at scale in the best possible manner. And when we think about the ecosystem, our philosophy always is to work with the local ecosystem, whether it is non-profits, whether it's academia, whether it's government, state governments, etc. So one of the partnerships that we are very happy about is our partnership with the Indian Institute of Science in a project also called Project HealthVaani, where we have sort of documented data sets for 109 languages and dialects across 31 states and union territories till date. And we make these data sets available through the government's Bhashini project. Mm-hmm. And I tell you, many of these dialects and languages do not have any corpus. They are called low resource languages, which means the speakers of those languages also don't have access to the digital ecosystem that is developing rapidly in the country. And so from an inclusion point of view, it is very critical for us that we are designing for that. And in that partnership, to make sure that the solutions that we offer work. And I'll give you a couple of examples. If you look at the solutions that local startups are working on, so Shillong-based MWire Labs, they have used the data sets, the very conversational data sets provided by Project HealthVaani to train their models on voice speech recognition in Garo. And that is a language that has not been traditionally been a part of any AI models. And when they used these data sets, these localized data sets, they saw an amazing 97.5% improvement in accuracy rather than working on just the traditional models. And like I said, that means that the 1 million+ speakers of Garo are gonna be able to access a lot more services thanks to the work being done by MWire Labs. So when I go back to the original point I made, that for us it's about raising the floor for everyone, and technology has to benefit everyone, working on some of these very low corpus languages and making sure that they are available to the startup ecosystem or even the government to use to build on for solutions for all Indians is very critical.
And those are remarkable real-life examples. And Shekar, really, if every ASHA worker has these credible, validated healthcare information in her own dialect, not eventually, but tomorrow, what changes? Whether it's in terms of maternal mortality, child malnutrition, stunting, disease surveillance in the next epidemic, what becomes possible now?
Along 3 dimensions. The first dimension is the episode, the quality of service between the provider and the consumer, that gets significantly enhanced. The second is the provider's capability and the understanding of the provider themselves. And the third and the most important is going to be, as we roll it out, let us hypothetically assume this is rolled out pan-India. Mm-hmm. You will have millions of conversations which now will start establishing patterns using which you can do prediction of problems across India. So you will know in this particular district there has been an uptick in this particular problem, and if you can correlate it to the underlying reasons, you've provided the policymakers and the decision makers the ability to quickly drive financial resources to them. We already have a solution like that called media disease surveillance, where we look at the entire web and provide the government of India specific disease outbreaks. That used to come in a couple of days, it comes in 2 hours, less than 2 hours. So on that very day when the disease is starting to outbreak, they can take action. And that comes due to these technology interventions. That same thing becomes a reality. So the episode, the person, and the system improve.
No, and that really leads to the next bigger question and possibilities. Like, if we took this solution of AI delivering expert knowledge through a trusted, embedded frontline worker, is that model replicable? Can we use it for agriculture? Can we use it in education? Is the ASHA worker then a template for how India can solve its last mile problems, how the ASHA worker uses HealthVaani, a template then for how India can solve its last mile problems?
Absolutely. I mean, the most energizing part of AI as a technology is that we finally have that possibly that unlock for that population scale problem solving that we speak about when we think of India, you know, AI for all. And we are working in parallel. So I'll give you a few examples. Even in healthcare, we have a startup called AI Steth, which, you know, is using MedGemma. That's an outstanding, if I may say so myself, or open weight, open source medical, solution model, which empowers ASHA workers. It enables them to carry out, you know, lung screenings, heart screenings. It's a smart stethoscope, all right? And then Apollo Radiology International is also using some of these, models developed by Google researchers to carry out screenings for tuberculosis, breast cancer, lung cancer screenings at scale. When it comes to education, really proud to share that in the recent past, Google DeepMind, they have partnered with Atal Tinkering Labs to come up with a solution called Atal Sathi. Basically, it will empower educators. See, Sonia, you know, for us, when people talk about AI, a lot of people talk about students. And we think when we think about India, you have to work with the guru, the teacher. So empowering the teachers in multiple languages to deliver the curriculum in multiple languages, but also spark curiosity and learning and experiments. So that kind of a partnership, that app, you know, Atal Sathi is a very powerful toolkit and an example of technology coming for solutions in all parts of India in the field of STEM, and even not just rote learning, but we're talking about experiments. And then the last thing I'll speak about is agriculture. We have these our ALU and AMED models. Pretty much they have mapped the field boundaries in most of India. And now they are even coming up with crop level insights. Now, what all of that data does it gives startup founders and policymakers at state level, panchayat level, you know, build very cost effective and powerful solutions. You know, people like TerraStack who are looking at how can they provide more crop insurance or micro lending and all of that. So these are very powerful examples of the technology is one thing, but the use cases that can be built, you know. So we partner with the ecosystem to come up with these solutions so that we are solving these population scale challenges. And to give your answer in one line, very much replicable, you know.
That's really wonderful to hear. And a final question for you, Shekar, that there are ASHA workers across India who may hear or read about this conversation. What would you want them to know directly, personally, about what's being built for them with HealthVaani?
Simply put, we will build a trustable solution that you can rely on that will make your life easier.
And Preeti, really, it's wonderful that India's public healthcare system is now, it's being powered by over 1 million women who are walking into communities every single day with extraordinary responsibility and very little support. What does it mean to you personally that technology is showing up for them?
I would first want to say, if anyone is watching from the ASHA worker community, a huge thank you. I mean, I tell you, the work that you do, you know, for local communities is so powerful and transformative. So thank you so much for being out there, really supporting such a large number of Indians. And for me personally, it's very meaningful to be able to bring the best of technology out from the labs, from the researchers, from that esoteric field into real life use cases to reduce the friction that our amazing ASHA workers and these women face, just to make life a little bit simpler and more helpful, which aligns with Google's mission, right? To make information more helpful, accessible, and useful. You know, I'm very grateful to the ASHA workers, and it's very deeply meaningful for me. And it's a privilege and an honor that we can have this partnership to make some change which is making it easier for them to deliver healthcare to the local communities.
No, really, it's an extraordinary partnership, which I think is transforming the lives of not just over 1 million women, but the many more millions of families that they touch every day. So that's what we're saying, that it's what HealthVaani represents isn't just a product or a partnership. It really represents the unleashing of the AI potential to change lives and to use technology to give support to these women who are often carrying just a simple register and weighing scale and their own knowledge. That was all in today's episode of Blueprint to Bharat, powered by Google. Next time, we'll be in a different field, a different opportunity, and a different set of humans that technology is reaching out to. Thank you for watching.